In this video, I'm going to show you a simple postural relief exercise called Brugger's relief position that you can use periodically throughout your workday to eliminate much of the neck pain and shoulder pain and tension that plagues so many people. So to perform Brugger's relief exercise, what we're going to do is we're going to start by centering our head over our shoulders this way. We know from ergonomics that an average human head weighs anywhere from 8 to 12 pounds stacked vertically over your shoulders. And we also know that for every inch forward that our head drifts past our shoulders, it increases the weight of our head by about another 10 pounds. So if this is a 10-pound head, this is a 20-pound head, 30-pound head, 40-pound head, and now spend 40 hours a week sitting like that, and then people scratch their heads and wonder why they have chronic tension and tension headaches and neck pain and shoulder pain, and wonder why they can't get off this neck pain merry-go-round or this hamster wheel that so many people that come in and see me are stuck on. And I tell them passive therapies are great, but they're a band-aid solution until you correct what's driving a lot of this for a lot of people in the first place. And for the vast majority of neck issues and shoulder issues up in this part of the region, part of the spine or part of the body that I see, I would say 70 to 80% of it at least is all just chronic postural stresses we're all under. So massage therapy and chiropractic and acupuncture and so forth are great, but the real long-term fix, the real sort of meta-level permanent fix so that you can get off the hamster wheel, I guess, if you want to call it that, is to take little postural breaks every 30 to 60 minutes throughout your workday. So Swiss neurologist Dr. Alois Brugger gave us this wonderful, simple little exercise that feels great. It'll take you 20 to 30 seconds to do throughout your workday. So here's all we do. We're to start by lifting up, create a little space, a little length, lift through the chest and the top of the head, and then we're going to lightly retract the chin this way. Watch what happens to my neck more so than my chin. And watch what happens to my ears relative to my shoulders. See, we're just lightly pulling the neck back. It's called a head retraction. We're going to start here. We're not straining. It should be comfortable. We're looking to relieve tension here, not create tension. So a light retraction, almost like your head's on drawer sliders, just gently pulling your chin this way, make you talk a little funny. Holding this here then, we're going to splay the hands open nice and wide, corkscrew the thumbs out. This is going to open up the chest this way, and then we're going to pull the shoulders back and down, almost like you're trying to put the shoulder blades back into the back pockets. You should feel it here in these latissimus muscles and between the shoulder blades, back down. One thing to be careful of is, again, hands nice and wide, keep them this way, back, down. We don't want the shoulders here, we want them back, down. So you're squeezing the shoulder blades together and down, just gently. It should be comfortable. Again, hands open wide, chin lightly retracted. And then the last thing that we're going to do holding this here is we're going to drop the breathing from up here down here to the belly where it should be. We want to make sure that we're taking a nice big belly breath. One simple thing you can do is put one hand on your upper chest, one hand on your belly, and just breathe and practice making your hand here move. This should be moving more than this way. Another thing you can do is push your hands in your side and try to breathe in. Your hands should expand out. Your belly should expand when you're breathing properly. So light chin retraction, lifting through the head and chest. Hands open wide, corkscrew, shoulders back and down lightly. And lastly, drop the breath from here down into the belly. We're going to take 2 to 3 nice big belly breaths. It looks just like this. Take you maybe 20 to 30 seconds and you're done. Very simple. Where the magic happens with this is the cumulative effect of doing this all day, every 30 to 60 minutes, versus not doing it at all today or at all tomorrow. The people who I can get to do this, the patients of mine who have chronic neck issues versus the people who don't do this, are two very, very, very different outcomes over the course of the next few weeks and the next few months. The problem with this is that it's easy not to do. We're all busy, we all get caught up. And so what I recommend that you do if you're serious about this, set a timer on your phone, set a timer on your computer for 30 to 60-minute intervals. If you're currently having neck pain and shoulder pain and tension headaches and issues, you're experiencing what we call acute pain, you really want to do this every 30 minutes. And if I can get you to do this, I promise you this will make a very significant difference, probably the first day that you do it, if not the first few hours that you do it. Set a timer on your phone or your computer, stick up Post-it notes on your computer or in your workstation, wherever you work, to remind you, because we get busy, we forget, and 4.5 hours flies by and you haven't done this once. You're not going to get any benefit from it if you don't do it. So when you're having acute pain, you really want to do this every 30 minutes. Take this postural break, blows off steam, gives the tissues a rest, works muscles that need to be worked and lightly activated, stretches and opens up and releases muscles that need to be released, and just feels great to do. I could literally talk about what this does for probably an hour straight, and I might do a seminar at some point in time. It's that important. I can't stress the importance of this enough. Do this every 30 minutes and let me know how it works. Once you're feeling better, do this every 60 minutes. You really should do this at least once an hour for preventing neck pain and shoulder issues. That's all. Give it a try. Let me know what questions you have. I promise you though, if and when you do this consistently, it will make a huge difference.